if any of those hospitals have done it. For example, the Manipal General Hospital in Manipal, India, created a whole lot of things around it as a hospital, not with their main focus being that, but as a result of helping their patients. So all they're going to do is they're going to provide some of that practice. They're not going to go in and provide anything specific, saying start up a weavers community. No.
Yeah, because I could see that as being an issue with Scope Creek.
Yeah.
That by the time you look at what you've already got on there as your list of you can touch them, feel them objectives, along with looking at things like whatever sustainability means in terms of insurance and funding, that's huge already. So comments maybe that are not going to take up a lot of time, because when you go on to the research issues and the research objective slides, you don't talk about that. That's not on either of those slides. So you captured it at the very beginning and addressed it, but then when you started drilling down, we never heard about it again. So you either have to build it in or you have to take it out at some point. And it sounds like it should be there, so you might want to go back and just add that into those slides somehow, not as a main bullet, but maybe as a side bullet or something like that, okay? I'm wondering, because these two hospitals are they're in such different geographic areas. They're in everything about them demographically is so different. If it would be helpful to have a map that actually just shows where these hospitals are relative to Kigali and relative to Kampala.
Linda,
Yes.
This presentation is to the client.
Yeah.
The client knows where they are.
But there's going to be other people in that room that are not going to know where those hospitals are.
Not really. They're going to be from the other places. So if you could put it in, if you want to, but it's not, in my opinion, I don't think it's tremendous, because every slide you add, it takes away from something else.
Yeah, content, for me, I would have it in, just
Okay.
because even if I'm talking about it, I want to physically get people thinking about where they are.
Okay.
And there will be people there from Bawindi, not from Hitch, but from the other hospital, who I guarantee, they won't have visited the hospital in Mbarara. So anyway, that's just, all these are just ideas, so you do what you want with them. When you're presenting, it's always good to lose I. Now, it's I like this, or I
Actually, we
prefer
don't
this.
recommend that.
That's what I
TGEMBA
just-
thing, we say V.
That's what I was just saying, Sean.
Okay.
Yeah, okay. So we want to lose the I, and there's a couple of reasons for it. One is, if you get up there and use the I word, then you are ultimately responsible for any issues with that particular slide or with that particular. We talked about that in quant a lot, right? We don't want to use the I word. So a couple of you actually used it very energetically. So you might want to go back and just practice not using I, just using we. Okay, it sounds like Sham and I are on the same page with that. Okay. The research matrix, it's great to see, but I don't think we get a lot out of it in terms of a slide. There's just so much going on in it. So thank you for sharing that, and you look like you guys are right on target with being able to collect all your information. Slide number 30 and slide number 29, you're talking about descriptive research slide, so we're back one more. Yeah. Anyway, the words you're using are descriptive, secondary, and primary. And so when you talk about descriptive, I'm not quite sure where you're putting the secondary and primary in there. So just be consistent with your terms when you're talking about what kind of data you've got. And I know you all understand the difference between primary and secondary. Just be clear on what descriptive is when you put it up there. I would agree with Tina that you probably want to stick with just that term management objectives rather than going back and forth with client. And also, one other quick thing on Hitch, and maybe this is to Sham, isn't the catchment system one of the issues for the water? No?
They gave that up because we felt that the scope was too much. But yeah, you can put it in the problems, but it's for them. But what we did, Linda, what they did was they responded to our set of questions from from Hitch and said that, please, we are taking care of that, we're taking care of that.
Okay.
So we took it off.
Okay, because that was a big issue for them, just in terms of water. But overall, I thought, I liked your presentation style. I think you were clear and concise. Your slides are very readable. You addressed everything on the slides. just, I guess, as, you know, Dr. Lee was saying, as you go forward, you know, your audience is going to change a little in terms of how you're presenting. I love the timeline slide. I thought that's great. That's going to keep you focused, and also the tracking slide about where you are relative to achievements. Great slides. So well done, guys. Not guys. Well done, participants.
We have 2 minutes, so let me just say, add to the congratulations that my colleagues have given you. Very fine, very integrated together presentation. All 5 of you complement each other, which is wonderful. There's a seamless feeling here that this is a group working together, and so that's excellent. All of you have very good presentation skills. We'll have to work on the details, but it's very good, so keep that up. All of you are excellent speakers. You're very clear, you come across well, and so I agree with my colleagues. A couple of things I would keep in mind is to remember a few no-nos about presentation. One, you do not ever need to look at the screen, not even once. If you know your material, you never have to look at it. When it clicks, you're cheating from the computer screen. You don't turn back and look at the wall screen. The best person on that was Roxana, who tended to have the most forward contact. Many of you turned on the side and were looking up. Try to avoid that. That might be very helpful. It's easy to do. You'll become adept at doing that, okay? The other thing that I feel that many of you can work on is the preciseness of what you say. Very good, but work on it a little bit more to make the story, sometimes less is more. Okay, just try to see how you can work through that. In terms of how to structure a presentation, I would have loved to have seen a hook at the beginning instead of just a descriptive, you know, just what we're doing. There wasn't a story enough at this point, but that's fine. You've done a great job for a first presentation. As Dr. Lee put it, it was wonderfully well done for a first time. And I think you were trying to help this particular group learn about your project. So a lot of those slides will go away because they don't want to get the details of what you did inside the organization, how you put it together, what sequencing you did. All that can stay with you. You can focus, because time will be short. 1 hour, 15 minutes, 1 hour, 30 minutes. So you have to. But it's good. You did it. I really liked it. I thought it was very well done. Lots of progress. That's wonderful to see. At this stage, you've done a lot. Okay, and you're beginning to jump into your research. One of the things, your slide deck looks beautiful. I like the clean look of it, but sometimes there was too much on it. Russ, especially on your section. Yeah. Especially bullet points are bullets. They're not sentences. Okay. So these are good because they're bullets. All right. So that would have been something very helpful. And in general, I think somewhere you'll bring out the human part of this. Right now, it's too much of a Silicon Valley, North American presentation. But at some point, you'll bring in the, you know, because remember, you have a very passionate audience. You were very passionate too, which was great to see, as Dr. H said. It's great to see that passion, but you'll have to channel it to meet the passion. Doesn't mean you go, you know, you start crying and fall on the ground, you know, weeping. Yeah, okay, somewhere in between. All right, and sometimes there was so much material you had to move fast, so you kept moving and we never saw the material. For example, give you a classic example, the research methodology slide. And this is, Duane said, you all know what this is. Well, then why put up the slide? We all know what it is. I understand what you were doing, but you have to be careful about those things. If something's up there, you have to tell us. Otherwise, throw it out. Fundamental ground principle. Okay? I agree with Dr. H about the research matrix. Very nice, but you know, you razzle-dazzled us, but that's good. Okay? Leave it for the, say we did this in the research matrix. All right? Mm-hmm. There's too much of research problems. We'll work on all of that. You know, research questions, research problems. It became, but that's why this was the first time you were explaining that. So well done. I thought, like Dr. H, that if you had had a hook at the beginning and Dr. Z, if you had had a close at the end, kind of an opening and a close and a link there, the story would have been much better. But great job. I want to say what a great start to the whole thing. It's like you're already in your third presentation out of the total of 6. So fantastic. Right, well done.
Thank you.